Good evening, everyone. Welcome to today's training session. I'd like to appreciate each and everyone who has joined at this moment. We are going to look at project quality management. So, I guess I'll we'll start the session at 5:35. Maybe just 2 minutes for a few more people to join. Then we start the session.
Um, Hope we can start. Hello, everyone, and good evening. Um, we'll be looking at project quality management. But just before we start, while we are waiting for other members to join, um, probably you can get to look at the agenda items today. Diana, can you move to the next slide? So, so today we shall be looking at the introduction to project quality management. Key processes in project quality management, which are basically quality planning, quality assurance, and quality control. Then we'll look at quality, executing the quality management activities to assess performance and ensure the project outputs are complete, correct, and meet customer expectations. That's according to uh, the project management body of knowledge. So its importances include meeting customer uh, requirements, of course, with quality. The customer will be satisfied with either the product or service that you are providing. It also reduces on rework in a way that you don't have to work the processes that you went through to put out a service or product, or even receiving products with defects and needing to rework on them and fixing any defects that the products may be having. And this also interlinks with also meeting customer requirements. Uh, if customers are being provided with quality products and they don't have to return them to stores, or if you're providing services, they don't have to come back uh, to seek for the similar service. Then uh, due to poor quality, then they will be satisfied, and it will also reduce on reworking. And it also enhances project success. Um, so basically, the key benefits of this process is verifying that the project deliverables and work meet the requirements specified by the stakeholders. Um, so once the stakeholders agree that the product is of quality, then that means that they have agreed that you have met their expectations. Um, Next slide. So the key components in quality management is one, quality planning, establishing quality objectives, matrices, and processes, and we will be looking at that in detail. Then looking at quality assurance as the second component in quality management, and this is evaluating processes to ensure they comply with quality standards. And then the third is quality control. And here you are monitoring project outputs to identify defects and deviations from quality standards. Next slide. So with quality planning, what we have said about it is that we are establishing standards and matrices. And so how does this happen? One is we define quality objectives. And here we are defining this, what success would look like in terms of quality of our product or service that we are putting out there to the community. This could include uh, defining quality objectives on reliability, performance, uh, usability, and security. So when you're defining your objectives, you look at in terms of quality, you look at things to do with reliability. How reliable is the product that we are putting or service that you are putting out there? And this can be in terms of access to that service or product when someone needs it, uh, and many other aspects. Then you are looking at its performance, and here you are looking at the satisfaction derived uh, from from the product or service. So with performance, you are looking at things to do with client satisfaction. Uh, you are looking at durability of the product, uh, and you are looking at things to do with also the people themselves that are providing or who are are receiving this service. Uh, so you're looking at the user experience, and then you're also looking at the processes that are leading to the final client or end user receiving this product. Then you're looking at usability still when you're defining the quality. Uh, and this we've talked about under user experience. So if you're putting out, uh, for example, an app, uh, how usable is that app? And then you're also looking at things to do with security, and if it's a service, you're looking at things to do with confidentiality. So that is the way we define quality objectives, and these objectives should be measurable, they should be realistic, they should be time bound, and yes. So the next step is uh, research the industry standards in quality planning, and this is similar to establishing. Uh, you are investigating and establishing best practices and standards that are out there in your domain of work. This provides valuable benchmark information for quality expectations. At times, when you're investigating, you're really analyzing and looking at uh, what are the standards in the sector that you're working with, uh, and within actually the domains that you're working in. Uh, if you are in the public sector, there are guidelines that are support on this, and you should have those. For example, if you are within the education sector, then you should be looking at the current guidelines that the Ministry of Education has established, and you are using those to set your quality standards. and benchmarking so that you understand what are different stakeholders are expecting. And you're also understanding the requirements regarding the project's quality. Sometimes for those of people working in the health sector, you would find that you are looking at WHO standards, and you're looking at the domain of work that you're working in, and you're saying these are the set standards, and these are what we should follow uh, for us for our project to be successful. And the same applies also to other sectors, be it private, be it non-government, be it also public. Then after you've established, you've researched about the industry standards, and you have chosen those that are relevant to your project. Then you move on to establish the matrices, and here you are defining measurable matrices to assess the quality of the project deliverables. And these matrices should align with the quality objectives and should be quantifiable. So once you've established the matrices that you're going to use uh, uh, to measure your quality, and this can also be the things to do around adapting or developing questionnaires, and also looking at the different approaches out there that you're going to use in your project, and what indicators of success you would use. You would find that different institutions have different ways of measuring quality. So I'll be looking at that later on, but still, you have to know that at this stage, you're basically developing questionnaires, and these are based on quality standards that you have already established. So once you've understood how quality will be measured, and you have aligned those elements to the quality objectives, and they're quantifiable, then you start documenting these quality standards, and this should be agreed upon based on the quality standards with what the stakeholders want, and they should be in line with project documents such as the project charter. Uh, Remember that we talked about that during uh, project integration management, and also the introduction to project planning and management, where we say that it is the document that authorizes the existence of the project, and also authorizes the project manager to spend or utilize the project resources. So you're also looking at other projects like quality management plan, and you are also looking at requirement documents. Uh, so once you've documented these standards that you've established, and the matrices, then you implement the quality assurance processes. So with the quality assurance processes, these you have to develop, uh, and these procedures and processes ensure that quality standards are met throughout the project life cycle. This may include quality reviews, testing protocols, and quality assurance checks. Uh, so it depends on still this also depends on the sector that you are working with. If you are within the private sector and you are developing products, uh, you can always test before you put out your product on the market to see if it meets the SETA standard that you established in your uh, quality management plan and in the project chart and requirements document to ensure that it is within the required or expectations of the stakeholders, and then you put it out there. However, you may be providing a service and you may uh, rehearse. You've seen, for example, when musicians having shows, and for example, the show is a product, they'll spend some time rehearsing and until they perfect uh, their craft, and then be able to share it with the community. So sometimes you may be also implementing the project, and you may have already established quality standards. Like I said, for example, those that are working within the health sector, they may adopt quality standards from WHO, and they develop questionnaires around that, and then these questionnaires can be used during spot checks or during service delivery. Uh, Sometimes they also just have to you may just brainstorm about your product with the different stakeholders, and then you get input around what to do, and you document. So you continuously also monitor and improve on the quality. Uh, so once you've identified the different areas that need improvement, then you need to take corrective action as necessary to maintain or enhance the quality uh, standards or levels that you are expected to achieve. So yeah, this can be routine for those that are engaged within our project's work uh, on service delivery. You can always integrate those feedback loopholes on quality during your project execution, and be able to continuously monitor and improve on that. This can be even included in the routine activity reports, elements of quality monitoring, and we are able to easily identify these anomalies and take corrective action. So once you've monitored and you've identified and you're taking this corrective action, one of the other things that you should be doing is also providing capacity or trainings, and also conducting awareness about the agreed upon quality standards, such that individuals are able to know when they have deviated or when they're about to deviate from the set standards. So you are supposed to ensure that all your team members are aware of the quality standards, and they have all the necessary resources that they need uh, to be able to achieve the set standards that you provided as an institution. So these trainings you can be sometimes trainings can be through mentorship and coaching uh, for the staff, and you do this during anytime you get an opportunity to engage with the different stakeholders, and so you are able to look at your processes and also your products, and provide that corrective action if needed. So like I said, you should have these feedback mechanisms established uh, that collect information from the different stakeholders and teams regarding the quality. This can be some sort. You can use, for example, client satisfaction surveys, simple questionnaires. You've seen these at the service provision points, and that they're telling you to tell them about the quality of the service that you've received. If it's for a product, then you can include a toll-free number that individuals can call to raise any complaints, or even also uh, provide you feedback on their satisfaction of from using your product. Um, this mechanism can also uh, provide the quality managers or the project managers with information on the products that are having defects, and also they can be used to support our clients on using the product. So at the end of it all, documentation is key. Documenting and reporting on quality related activities and outcomes, and regularly reporting on the project's adherence to these quality standards. Uh, I know, for example, in Uganda here, uh, many ministries, especially the one for health is really moving into uh, having all these quality measurement tools customized into digital formats, and also these are also provide are also working hard to ensure that the end users receive prompt feedback. But yeah, you can always document your quality issues identified in your quality uh, improvement journal, and you also use that to track and report on quality issues identified, maybe to the supervisors, or even to higher ups like ministries and the like. So let's move on to the next slide. So what we have next is the quality assurance, and this involves systematic activities to ensure that the project meets quality standards. So we have to take note of quality assurance and quality control. Quality assurance is more onto the side of let's say it would be basically the preventive side or the maintenance side, and then control is really more about auditing and testing to see that products of of, uh, of the set quality standards. So within quality assurance, we have some processes and procedures that we can undertake to ensure that our end products are of quality. And these can include quality planning, where you define the quality standards, matrices, and processes, like we've said. You can use quality audits, and these are conducted regularly to ensure compliance with the quality standards and identifying areas for improvement. These audits can be spot checks for service delivery, and there may be also some other routine uh, support supervision visits that where you've integrated quality, uh, measuring quality assurance, and also informing what you need to include in your plan. Then I will have process improvement. Uh, so here you are continuously improving the processes of a project or activity to enhance quality and efficacy. And basically, what you are doing here is you are monitoring the processes and looking at their efficiency and effectiveness, and then making suggestions on if these processes should be improved or optimized, or they should be maintained uh, if they are performing at optimal level. So also some of the procedures or processes for quality assurance include training and education. And here staff this is basically on the staff side, or even the user, the stakeholders, the end users. You train them, and they understand and adhere to the quality standards and procedures. So once someone, for example, if a user knows the quality standards of a service they are supposed to receive, then they can always also keep in check the person providing that. If it is a product and the users know the quality of the product they're supposed to get, then in case of any deviation from the standards that or expectations of the user, then like I said, of course, with quality control, quality management, we need to have those feedback mechanisms. Once you have those in place, then uh, the person, the end user, should be able to provide the feedback, and you should be able to capture it and document it and make the necessary changes or uh, actions to improve the quality. And still, you also have to be knowing of the change management protocols that exist within the institution, and what should be followed for you to effect that change. So the other procedures that we have or processes that we have under quality assurance is quality reviews, and these should be conducted throughout the project life cycle to assess adherence to quality standards and identify the different corrective action. Uh, so, as an institution, as a project manager, you should integrate quality. Uh, you should integrate quality, quality management or quality control and or quality assurance uh, elements within your performance reviews, be it for the project and be it for the institution. Sometimes one of the ways also to gauge if the products or services they are putting out there of quality is to also participate in different conferences and getting to know what other institutions or what other individuals are doing out there in terms of quality. Next slide, please. So we have quality control, which is our next element in quality management. And here we have the different inputs and outputs based on the professional body that governs project management. So for them, they recommend that all the inputs that should be used in quality control include the project management plan, Because within this, you have the scoop and different timelines and also how you will manage quality, which is the quality management plan within the project management plan. So yeah, you should always refer to this to always to always understand the quality control measures that you want to use for your project. Then I will have project documents. And like I said, these may be standards. I used an example of the health sector where they often refer to Ministry of Health or WHO standards. And once you have these, I said that it's always good for you to have these standards integrated within your routine uh, uh, support supervision activities, and you integrate them as questionnaires that individuals that are going out there to conduct that site support supervisions assess these these are standards based on the service that you're providing or the product that you're providing. So with this, once you have these documents, then you have a means of verifying. You are able to establish a means of verifying the different standards or objectives that you set out there. We have, I talked about inputs and we talked about change requests and these and having that change change approvals mechanisms in place, and this should be in line with work performance at the end of it all in terms of information. Then, like I said, we have the quality standards that are matrices that you may develop as an individual, and these look at you should also have the outputs as change requests that are put there based on the deliverables that you established. So once you've collected data around those and matrices, and then you're able to understand where the different change requests are coming from. Then we have work performance data, and this is basically the processes that you're looking at. You're looking at also enterprise environment factors and organizational process assets as some of the inputs, and then you're having the different project documents that are affected by these quality changes that you might make updated. And we say that this also starts directly from the project charter, and you move on to the project management plan, and you're updating it, and also so you have to have all those processes in place and procedures in place for you to make those changes, and also approval levels. Next slide, please. So how do we control control for quality? We do inspections and testings. If you're putting out a product, you're supposed to inspect its usability. You're supposed to inspect the different features on the product and ensure that they meet the expectations of the stakeholders. And the other is also testing to identify any defects, and ensuring that the deliverables meet the quality standards that you would have established in your quality assurance plans. Then we also have statistical processes. uh, that control for quality. And these we use different statistical techniques to monitor and control for processes, identify variations, and also take corrective action as necessary. So then we have the quality checks. These I've talked about, and we use this to systematically evaluate deliverables against predetermined quality criteria. And then we have root cause analysis, where we analyze, we identify the underlying causes of quality issues and implement corrective actions to prevent reoccurrence. Then we also have quality feedback loops on quality, and these are gather input from stakeholders and different team members on the quality issues and areas for improvement. Next slide, please. So we have some quality tools and techniques that are commonly used. We have the Ishikawa diagram or the fishbone diagram, and it's a tool used to identify root causes of potential defects or quality issues in processes. We also have Pareto charts, and these identify the most significant factors contributing to quality problems. Uh, you can read about Pareto optimality around that. We have a statistical sampling, where we use statistical techniques to assess the quality of a product or process. Then I also have control graphs, charts that are tools for monitoring and controlling processes over time. There are others also like the Kaizen, developed by the Japanese, that they use out there. Let's move on to the next slide, and we have a look at how the fishbone works. So basically here you identify the different causes. Uh, so each bone of a fish will represent a different cause. For example, in this we have uh, uh, effects of effects of different environment, different factors on the environment. Uh, you can look at the different things that are being used and also that are impact the environment, the causes for each bone, and then you sum it up with the effects, and then at the end of it all, you always change these causes into objectives, and the effect into the general impact, and also you are able to understand the different quality dimensions. I'll suggest you read more about this. Next slide, please. So we have these Pareto charts. These are usually provide, these are statistical, and they define what the optimum is. So here you have the different factors on the horizontal scale, and on the vertical scale you have the different you do have the different there are different performance on quality. So with this you have to have information around the different factors that are affecting quality, and how they are performing, and then you are able to establish if they are performing within optimum, or the efficient and sufficient standards that were set up in terms of quality. and if they need optimization. So that's how our Pareto graphs look like. Let's move on to the next. Yeah, so we have the statistical sampling, and here with statistical sampling, we are looking at the different statistical techniques that can be used uh, for one to measure performance of quality. And here you have the simple random sampling, where randomly sampling elements or features of a product on quality, and then establishing if it is within the set standard or not. We have a stratified uh, uh, sampling, systematic, cluster, convenient, and purposive and sequential sampling. Can always read about those to get to understand them more. Let's move on to the next. So we have these control charts, and these are also some of the tools that we use to monitor for quality. So these are basically trend lines, and you're looking at a performance of a product or process or an attribute of be it a product or service that you are providing, and you've established the accepted standard. You have also established an upper control limit and then a lower control limit. So once anything is below average, then you need to design or review your processes and ensure that that element is satisfactory in terms of quality standards or the quality criteria that you would have established. So that's how those look like. Next. So we have continuous quality improvement. Let's go back, please. So we have continuous quality improvement, and this we say that quality improvement happens throughout the project life cycle. And there are some methods that have been put out there uh, uh, to, to measure quality improvement, to measure quality and also improve uh, uh, the quality of a product and in a continuous manner. So we have the Six Sigma method, and this is data-driven approach focused on improving quality by reducing defects and variability in processes. We'll be looking at that in detail. Then I have total quality management as another method or approach that emphasizes continuous improvement, customer focus, and employee involvement in quality management processes. Then we have the ISO standards. Some institutions that adopt these. These are provide a framework for implementing quality management systems, and there are many depending on your sector that you're working in. Then we have lean management, and it's a method focusing on eliminating waste and optimizing processes to improve quality and efficiency. And this can be integrated within the Six Sigma, and then we worked with both of the methods are worked with together. Then we have the agile And this we talked about during our uh, uh, was it a lecture on schedule management where we talked about adaptive implementation. So some of these methods are also applied here in quality management, and these agile methods emphasize collaboration, flexibility, and continuous improvement with a focus on delivering high quality products incrementally. Okay, so let's move on to the next slide where we're going to look at the Six Sigma. So with the Six Sigma, it is a set of methodologies and tools used to improve business processes by reducing defects and errors, minimizing variations, and increasing quality and efficiency. The goal of the Six Sigma is to achieve a level of quality that is nearly perfect, with only 3.4% defects per million opportunities. So this approach uses a structured approach called define, measure, analyze, improve, and control. Um, as one of the approaches, are the most frequently used approach under the Six Sigma. And it is used to identify and eliminate causes of variations and improve processes. It's based on the Greek word or symbol sigma, and it uses statistical measures uh, to measure deviation from the process mean or target. So basically, here you are looking at the bell curve that is used in statistics, uh, and the sigma is a symbol of a single standard deviation from the mean. So if the process has, say, around six sigmas, and three above and three below the mean, then the defect rate is classified as extremely low. So you can always read about this. Their courses online, certificate courses online on how to use this. But maybe to talk about this Six Sigma, the first step is defining, and this is a customer or a client focused, and you identify the problem and you define it based on the customer's perspective. So once you do that, still under defining, you set the goals and then map the process with with the different stakeholders to ensure that you receive the right feedback. So basically, this is more of defining your quality standards, and then the next step is how you measure them. And we talked about the matrices and how they are developed, and the tools are used in measurement. So here you are looking at how do you improve, how do you quantify, basically, how do you measure your problem in terms of numbers, or with the available data that you have, and also defining the different yardstick for you to be able to know that the quality is within set standards or as agreed upon by the different stakeholders. And so still with measurement, it supports us to evaluate and also know if we have achieved our outcome. So once you've done that and you've measured, basically you are using the information under measurement to collect the data. Then you analyze the information. So you determine if the process is efficient or effective. If the process achieved what you determined as success, and you are able to understand or quantify your results and know that we are within the agreed standards, or we have variations. Uh, Remember, we talked about use of trends. So you can also analyze information here and know where the defects are coming from using your trends or control charts. Or so once you've done that, then you improve. Of course, once you've analyzed and interpreted your findings, then you should be able to improve, discover the difference relationship between the variables, and then you decide on the action steps that you're going to take. Then once you've done that, then still you control for quality to ensure that you don't deviate uh, from the set standard. So basically, that is it about the Six Sigma. Uh, Next step. Next, next slide. So the other, we have total quality management, and this can be summarized as a management system for customer-focused organizations that involves all employees in continual improvement. It uses strategy, data, and effective communication to integrate the quality disciplines into the culture and activities of the organization. So with total quality management, you're looking at, when we talk about quality, we are looking at the different products. You're looking at the different features and how they satisfy the different end users. You're looking at the processes. Uh, are they running up optimally as required, and are they putting out the required outputs as you need them, or results as you need them? And if not, then you're collecting data around that, and then informing course correction. You're looking at the different activities that are being conducted also out there. So you're monitoring monitoring the activities, and looking at their performance, and then also you're looking at the institution itself in terms of quality. Then when it comes to management of quality, you are looking at the different teams. You're looking at the skills they have, and you're looking at also the responsibilities that they have in terms of quality assurance or quality control. Then when you're looking at the total component of total quality management, you're looking at the different suppliers or people providing you with inputs, or the different inputs or requirements that you require. You're looking at the employees. Do they have the skills and the different technologies that they need to execute their activities in a course, put out that product in a quality as per the quality standards. And then you're also looking at the clients themselves or end users. and determining if their their products uh, of the product that we are putting out is really of quality. So basically, with total quality management, it is customer focused. It has employee involvement. It looks at the different processes and how they can be integrated. Uh, it looks at also the strategic approach, and use all that information to continuously improve, and also make decisions and communicate those decisions. Um, so that is it. You can always also read about the total quality management, and how it is being used by different institutions. Next, we'll move on to the next slide. So yeah, we've talked about these principles that are of total quality. That is, we have a customer focus, and we say that the employees should be involved, and it should be process centered. Uh, it should be integrated. Should focus on strategic and systematic. It should have a systematic and strategic approach. I should also always feed into continuous improvement, and should be fact-based uh, uh, while making decisions around quality. And you should always communicate your quality standards such that everyone is aware of them, and they are able to report on any defects or deviations from the set standards. Yes, next slide. Yeah, so we have also the lean management process, and this is an approach to managing an organization that supports the concept of continuous improvement. It looks at a long-term approach to work that systematically seeks to achieve smaller incremental changes in process to improve efficiency and quality. So lean management basically looks at uh, uh, this quality management approach was started by Toyota in the 1940s, uh, and they established the fundamental 5 principles of lean management, and their goal was to decrease the amount of processes that were not producing value. So basically, you're looking at your processes, and identifying the different processes that are not producing value, and we are eliminating them, or you're trying to optimize them, and or replacing them with others that are more efficient, and putting out this value. So the 5 principles that Toyota really put out was you identify the value, which is the first step in management, and this means finding the problem that the customer needs resolved, and making the product the solution, or putting out the service as a solution. So for them, Toyota is a profit-making institution, and with them, they're saying that this solution, meaning that the product or service that you're putting out there, you should consider that the customer should be able to pay for it. So meaning that for in all your processes, in case they're not adding that value, meaning that then that they are useless, and the final product is considered a waste. So it should be eliminated. Then the second principle or step was uh, value stream mapping. This is basically looking at the institution's workflows, including actions and people who contribute to the process of creating and delivering the service or product to the end user. So once you've visualized this can be like this is some sort of client journey. Uh, then you are able to determine what value each workflow brings. Uh, so, for example, if you are running a project and then you are looking at, say, the social behavior change team, and you are looking at also the programs or the technical team, and you are looking at also other workflows that are involved. And in case you identify, say, you are looking at also monitoring and evaluation as part of the workflow. And in case you identify that some of the activities or uh, strategies that are these are different departments are using and not really contributing to the end value of the client, then you eliminate those. So the third step principle they talked about was creating a continuous workflow. And this means ensuring each team workflow progresses smoothly and preventing interruptions or bottlenecks that may occur within cross-functional teams. Um, so here you are looking at using visuals. At some point in monitoring and evaluation, you find that you need, say, for example, to establish the workflow or the reporting process flow of the management information system, and you are able to establish the different timelines. Uh, for example, now if it is a programs, then you are looking at your Gantt chart and you are establishing the different timelines, and you're looking at the different teams that are involved, and you are continuously uh, informing these people. So breaking the total work process into a collection of small parts and visualizing the workflow facilitates removing process interruptions and roadblocks. Like I said, for example, under the monitoring and evaluation, if you are reporting and everyone knows the reporting timelines, they know who they are supposed to report to, then you easily identify any defects within your workflow, and be able to improve. If you are in the programs programming and are providing this technical support, for example, be it for a profitable product that you are putting out there, then once you've streamlined that and you know that these are the people these are the raw materials that we need, and these are the people that will be working on that and all that. By the end of the time, the product is out there, or in case of you are doing incremental quality checks on the product's development, then you are going to easily identify the defects across the workflow, and then take corrective action. So the fourth step is they are saying developing a post system under the lean management system, and this ensures that the continuous workflow remains stable, guarantees that the team deliver work assignments fast and with less effort. So they're saying that a pull system is specific lean technique that decreases waste of any products, uh, uh, and that the new work is only started if there is a demand for it. So meaning that you're looking at your processes and then providing advantage of minimizing overhead costs. Uh, for example, if you are putting out products, then for you to develop, for you to have a pull system, that means that you know the quantities that you are putting out there, and also your uptake based on the market demand. So this way you produce what you can actually store at your factory, and then once uh, uh, other than you renting out different storage areas and incurring more costs. So there's a quality, continuous quality improvement, and this is like the most important step. And I said that this is applied across the different stages. So here you can use a variety of techniques, and you are continuously monitoring for your quality outputs, and then also uh, uh, making taking corrective action. Next slide. So we have some of the best practices in uh, quality management. We have a clear communication. Uh, Once communication is of quality standards, once people know the quality standards, they know the procedures and expectations by all stakeholders and team members, then for sure uh, the quality of your product or service will be maintained. Then always document. You're supposed to always maintain a thorough documentation of quality assurance and control processes, including standards, procedures, test plans, and results. Then continuously improve, foster continuous improvement, uh, quality improvement culture within the institution by encouraging feedback, learning from experience, and implementing lessons learned. Then we have manage the risk, integrate quality assurance and control activities within risk processes to identify and mitigate quality-related risks. And of course, I always have that leadership support. Once the leaders really support the product also process, then other individuals will prioritize it and allocate resources to ensure quality assurance and control. I think that's it. Next slide. I think that's it. I don't know if you have any questions or comments. Uh, Feel free to unmute and ask. Diana, you can stop sharing such that I'm able to see the individuals asking.
I think Evelyn has a question. Maybe you can just unmute and ask your question.
Yes, good evening, members. It's not really a question, but just thanking Mr. Goloba for the presentation, because there are terms that have been confusing me. I meet them sometimes and I get so confused. Now, like quality assurance and quality control, he has made it so clear that I've understood. Probably I was just requesting for the attendance for today, the link to the attendance of today. Thank you.
Okay, thank you, Evelyn. We'll share the attendance register in a moment. Any other person with a question?
Any question or comment? Thanks, the previous speaker. Yes, maybe to re-emphasize quality assurance and quality control. For quality assurance focuses on preventing deviation or errors in the processes used to create products or deliver services. While quality control focuses on identifying these defects and errors in the product or service. So basically, the goal is for quality control is to identify and correct any deviations from established standards, while quality assurance is to ensure that the processes are designed and implemented effectively to produce reliable and high quality products or outcomes. Just wanted to re-emphasize that. Any other question or comment? Um, yeah, members, you can read also about the Kaizenian cycle of continuous improvement. It's out there also. Any other question or comments? Okay, if there are no questions or comments, then I will leave it at that. I will invite Stevia or Diana to come in and close. Next week, we'll be looking at project resource mobilization. Back to you, Diana or Stevia, to close this off.
Okay, we've just shared the attendance register in the comment section. So thank you so much, Mr. Ronald, for the informative, comprehensive training that you've taken us through. I'm sure most of us have learned a lot, including the last section that was talking about the best practice to use when it comes to project management. So I hope we're not leaving anyone behind, or we're not closing room for any question or comments. If you have any questions for the trainer, this is your chance. Remember to fill in the attendance register before you exit. Feel free to exit, but first, let us all appreciate the trainer for a good job that he has done today. Pew, 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 pew. You are free to leave the meeting. I guess we have come to the end of today's training. Once you've signed the attendance register, you can freely exit.